My name is Stefani Martin. I have 2 living children, and I have Isabella would be 1 April 21st. The sonographer, we saw the heartbeat. We could see 2 hands, 2 feet. There's the kidneys. Everything looks great. We found out it was a girl. On Friday, my midwife called me. I could just tell immediately something was wrong. Severe brain abnormalities. I knew what that meant, or, that couldn't be good. I've never had a hospital birth. I've never, had a OBGYN, deliver a baby in a hospital. Who's MFit? And that's the maternal fetal medicine specialist, and she'll be able to tell you more in depth what this means, and I can't really tell you.
My name is Dr. Surumi. I am a board-certified obstetrician and gynecologist that is fellowship trained in maternal fetal medicine. Maternal fetal medicine was launched here in September 2019. The most important aspect of care coordination is really individualized care, to take every single patient and meet them where they're at, to understand exactly what's happening with them, and to be able to then coordinate care around that. And so really it's about providing individualized care for that patient.
Isabella's father and myself, we were with Dr. Surumi for 4 hours. She was very thorough with us and told us exactly what she saw. Ultimately, she told us at that appointment that our daughter's condition was terminal.
Part of the reason why I went into this profession is because women, during a time where it's supposed to be a wonderful and joyful time, sometimes experience an unexpected diagnosis and unexpected loss. And so maternal fetal medicine gives me the opportunity to work very closely with women during this difficult journey.
Dr. Surumi told me, this is your time with your daughter. These are the moments that you have. If you're just having a rough week and it's a week you don't have an appointment, if you want to see your daughter, just come by, stop by, call us. We know that this is important, because you don't know how much time you're going to have with her. The lady that gave us the tour, we went through the NICU, and we went through the where I would have a C-section if that was the route we went. And she said, I'll never forget this. She said, "See all these nurses?" And I'm trying to hold it together because I don't want to be having a hospital birth and I don't want to be having a sick daughter, And she said, "You see all these people?" She said, "They're all on your team. We are here for you, and you're gonna see them." And I remember in the hospital, I'm like, these people are seeing me at my very worst.
Miss Stefani, I remember the very first day that she came to our clinic, I actually checked her in, and just remembering the worry and concern in both her and her partner's face, and the uncertainty of just not knowing what to expect. My name is Mackenzie Newsom, and I'm the practice supervisor for Maternal Fetal Medicine Trinity Clinic. I'm really thankful for the palliative care program because it really kind of gives a sense of what MFM means, maternal fetal medicine, surrounding those women that may not have that family support, but we're able to give them this family support from our family here.
Perinatal palliative care meeting where we coordinate care between neonatology, sometimes pediatrics, with the CHRISTUS Cares Clinic, and also with hospice care to help that mother and her family through that journey.
I think they're a huge part of Isabella's story. I don't know how they do what they do, because they certainly made a difference for us.
Stefani's story is one of faith and resilience. Her positivity, even after the worst possible diagnosis, has moved her to become a wonderful resource for other moms who have difficult outcomes.
And they had another family with the same diagnosis, and they said, we're not going to share anything about your story, but would you be willing to talk to her if we just give her your number or give her your email address? Is that okay? And I said, sure. Isabella was born via C-section on April 21st, 2020, and she lived for 3 hours. Grateful that we did have that time with her, even though it was only 3 hours.
It's a heartbreaking moment for a family when their unborn child is diagnosed with complications. Each year, thousands of East Texas women diagnosed with a high-risk pregnancy are forced to travel outside of the area, back and forth to large cities for specialized observation and treatment. This adds stress to an already difficult diagnosis and is impossible for many. The CHRISTUS Trinity Mother Francis Foundation Women's Board has chosen the maternal fetal medicine program as their 2021 fundraising initiative. They are raising financial support to purchase an advanced 4D ultrasound system. The advanced 4D ultrasound system goes beyond detailed still images of the infant seen in a 3D ultrasound. The 4D sonogram image shows real-time movement like a video, allowing the doctor to assess fetal movement of the limbs and the face, breathing movements, swallowing, and isolated eye blinking. The depth of 4D ultrasound imaging is remarkably effective in detecting issues such as cleft lip, heart defects, skeletal problems, and neuronal abnormalities. We are grateful to all who will contribute to our mission and invest in the future of maternal fetal medicine.